All right, we're back. Let's talk about diabetes care. I have my glasses on here because I have to read some bragging things, but it's all good stuff. From my notes here, Northshore Internal Medicine Associates, which is a North Oaks physician group clinic in Hammond, has been recognized by the National Committee for Quality Assurance Diabetes Recognition Program for excellence in caring for patients with diabetes. Dr. Charles Ducombs is here with us this morning. Good morning, sir. How are you?
Good to see you, man.
He helps out people who have diabetes. Congratulations, by the way.
Thank you.
Great honor, and it's a 3-year award, if you will.
Correct.
Okay.
Correct. National Committee for Quality for Diabetic Management, meeting certain parameters for good glycemic control, blood pressure control, cholesterol, right. But it has to do with the management of diabetes, which is pretty insidious around Louisiana.
I read that. We rank 10th in the nation, something you don't want to be in the top 10 for, but we're 10th for the prevalence of diabetes in Louisiana. I guess that's the way we eat.
Right. Good food, but it also means high diabetes, high lipids.
Yeah.
And I want to say the stats may tell you 7 in 100 people have diabetes. I'll submit it's probably higher than that. Because it goes unrecognized, absolutely.
Yeah. Now, there are different types of diabetes. There's type 1, there's type 2. It gets very confusing. Talk about the 2 types.
Type 1, the majority of these patients are going to be younger when they're diagnosed. They have a defect where they can't make insulin. They need insulin to survive. Same symptoms, increased thirst, urination, maybe some blurry vision. Type 2 by far is what we see around here. That's more of a preventable type because that's what you put in your mouth. Okay. That's adult onset. Same symptoms.
Right. So type 1 is what we always refer to as insulin dependent.
Correct.
If you don't get insulin, you die.
Right. Or juvenile diabetes. Now you can have type 2 diabetics who require insulin, but for the most part, that has to do with certain metabolic abnormalities.
I kind of interrupted you, but it's important. For type 2, you're not insulin dependent. It's more diet and exercise dependent, right?
Correct. You can become insulin dependent, but yes, type 2, same symptoms. People tend to be overweight. You initially get diagnosed when you have a little bit excessive thirst, urination, excessive hunger. That when it gets real bad, you actually can lose weight. And it's one of those where I'd rank up there with hypertension or high cholesterol as a silent killer. You don't know till after the complications unless you go to your doctor and get screening.
And the warning signs, again, are
increased urination.
Blurred vision.
Correct.
Slow cuts and bruises that won't heal well.
Correct.
Recurring skin, gum, or bladder infections, and even a tingling or numbness in the feet or hands.
Right. That's called peripheral neuropathy. That generally affects people after they've had diabetes for some time.
Okay. And it's true that type 2 can turn into type 1 if it just goes untreated, correct?
It can become an insulin-dependent type diabetes. It's still technically type 2, but you can require insulin.
So if I come see you and you say you're type 2, the first thing you're going to tell me is?
Usually it goes along with change your diet, lose weight, increase your aerobic exercise.
Right. Is it because we're so sedentary that you're seeing so much type 2?
That's part of the problem, absolutely. Yeah. And the studies will back it up. I mean, this is becoming a problem also with juveniles, with adolescents. Even though they're not a type 1 diabetic, when they get into their early 20s, which I see all the time, they're getting something called the metabolic syndrome where they're becoming insulin resistant, and you're seeing the beginnings of diabetes.
Not to get overly doctory here, or overly technical, but talk about why exercise helps. Why does exercise, because it's the way it burns up the glucose?
Exercise absolutely can speed up your metabolism and help to lose weight. Absolutely. If you're going to eat the food around South Louisiana, you're going to find a way to burn it off. Otherwise, you can become a type 2 diabetic, absolutely.
Interesting. Okay. Well, if you need to know more, the website can provide lots of information, northoaks.org. Just go to northoaks.org, and again, congratulations on the honor. I know you have a great staff you've surrounded yourself with there as well.
Absolutely.
But congrats to North Oaks Internal Medicine Associates for their fantastic award and honor. Thank you much. We'll come right back when we continue in just a moment. We're going to talk about what's happening with the Baton Rouge Ballet, and we'll also check the weekend weather forecast in a moment here on Baton Rouge Lagniappe.